Hello, it's Dr. Rhonda Johnson. Today is Tuesday, April 25th, 2023. Today I'm talking about stomach cancer because one of the viewers yesterday asked me, what can we do to prevent stomach cancer? So I want to give you two websites that I use, the Mayo Clinic website and the NoStomachForCancer.org website for more information. Now, we all know what the stomach is. It's an organ that breaks down and digests our food. Now, stomach cancer starts when you have an abnormal growth of cells in the stomach. It's the fifth most common cancer in the world. Around 1 million people are going to be diagnosed this year, and nearly 780,000 people around the world will die from stomach cancer. It is estimated that stomach cancer has a 5-year survival of around 31%. Now, it's not clear what causes stomach cancer, but we do know there are some associated risk factors. Now, you already know from previous videos that I've done, just because you have a risk factor does not necessarily mean you're going to get a disease. But here are some behavioral or lifestyle risks that you can modify, such as smoking, obesity, eating a diet. Don't eat diets that are rich in smoked, salted, and pickled foods. That was hard. I'll do it again. Smoked, salted, and pickled foods. Diets that are high in that increase your risk of stomach cancer. Diets that are low in fresh fruits and vegetables. Helicobacter pylori or H. pylori bacterial infection can be a risk factor. Now, risks that can't be modified, you can't do anything about your age. The older you get, the higher your risk. If you're male, if you have a family history of stomach polyps or stomach cancer, or if you have certain type of genetic syndromes that increase your risk of stomach cancer and other cancers like Lynch syndrome and hereditary polyps syndromes. Now, if you're African American, Hispanic American, a Pacific Islander, or Asian, you are at a higher risk for stomach cancer. Now, I want to talk a little bit about H. pylori. It's a bacteria that infects the lining of the stomach. It's common. Most people in the world, at least 50% of the people have it, get infected during childhood. And you don't have symptoms, but if you ever have symptoms, if H. pylori gets overgrown in your stomach, it can cause burning or pain, stomach pain that occurs even when you don't have anything in your stomach is empty, frequent burping, bloating, gas, loss of appetite, and unintentional weight loss. That means you could have H. pylori. See your doctor if you're worried. Now, symptoms of stomach cancer, what are they? Well, unfortunately, stomach cancer doesn't usually have any symptoms until stomach cancer is advanced. But some early symptoms might include indigestion and pain in the upper part of your abdomen. And later stages of stomach cancer might cause you to feel full, very tired, losing weight without trying, vomiting blood, and having coffee ground type black stools. So when should you see a doctor? If you have any signs or symptoms that worry you about anything, please make an appointment, see a doctor, because many conditions can cause those same symptoms of stomach cancer, and your doctor can test you for H. pylori infection. Now, what do you do to prevent cancer of the stomach? Well, to lower your risk, eat plenty of fresh fruits and vegetables. Choose a variety of colorful fruits and vegetables because, again, they're high in antioxidants. You want to reduce the amount of salty and smoked foods that you eat, period. And if you're a smoker, do everything you can to stop smoking. I know it's hard. You might have to get help. You might have to be on an over-the-counter or prescription medication. And also, you should always talk to your doctor. Certain type cancers run in your family. If anybody in your family has had stomach cancer, the rest of the family should know it and they should see their doctor. Now, screening tests can detect stomach cancer. The best way to diagnose stomach cancer is to do a biopsy of the stomach. Usually, a gastroenterologist uses an endoscope, which is a camera, and takes biopsy samples of different parts of the stomach, which are sent to pathology to look for cancer cells. Other tests can also be used to diagnose stomach cancer. So I want you to remember what I'm sharing. This information is current as of today. Healthcare is always changing. There are always medical advances in healthcare. So none of this information, folks, is meant to replace That visit, that very important visit to your doctor, always ask your doctor, consult your doctor for medical advice. That's my message today. Be well, take care.